Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. How botulism spreads and how it's treated. Botulism is a rare but potentially fatal illness caused by botulinum toxin, a toxin produced by a bacterium called Clostridium botulinum. In the United States, most cases of foodborne botulism are associated with improperly canned homemade foods, not commercially packaged foods. /r/n/r/n symptoms of botulism include muscle paralysis, usually beginning in the face, for example, droopy eyelids and/or slurred speech. The paralysis may then spread downward, affecting the muscles in your neck, chest, arms, and legs. Immediate medical attention is needed. /r/n/r/n botulism poisoning is a serious illness that can occur when you are exposed to botulinum toxin. The toxin is produced by a bacterium called Clostridium botulinum, though Clostridium butyricum and Clostridium baratii also produce this toxin. /r/n/r/n botulism bacteria create spores, which help them survive in extreme conditions. The spores themselves do not cause illness, but they will grow and produce toxin under certain conditions, including /r/n/r/n. The spores produce toxin more rapidly at higher temperatures. Some types of C. botulinum increase growth and toxin production at temperatures as low as 38 degrees Fahrenheit, 3.3 degrees Celsius. /r/n/r/n botulinum toxin is a neurotoxin that binds to the tiny space between a nerve and a muscle. This prevents the nerve from sending a message to the corresponding muscle. When a nerve cannot send a message to direct a muscle to move, the muscle becomes paralyzed. /r/n/r/n botulism classically causes paralysis of the facial muscles first. This may cause one or more of the following, /r/n/r/n as the bacteria can produce large amounts of botulinum toxin, it can spread throughout the body, paralyzing many muscles simultaneously. These may be in the neck, arms, chest/trunk, or legs. /r/n/r/n anyone can develop botulism, including babies and young children. Instead of the above symptoms, though, infants with botulism may, /r/n/r/n if you experience or observe the signs and symptoms of botulism, seek immediate medical attention. The toxin released from the bacterium that causes botulism can rapidly cause dangerous paralysis, after which the condition is much more problematic and recovery is difficult. Botulism can be life-threatening. /r/n/r/n There are 5 types of syndromes related to botulism. They all cause similar symptoms related to muscle paralysis, though their origins differ. All types can be fatal. /r/n/r/n In the United States, infant botulism is the most common type, accounting for around 71% of known cases. Wound botulism accounts for around 10% of known cases, and foodborne botulism accounts for less than 1%. /r/n/r/n botulinum toxin can enter a canned food item through a dent, slit, or a small hole in the can and grow prior to the food's consumption. Consuming even a small amount of a food that is contaminated can have serious effects. /r/n/r/n Certain foods are at greater risk than others, as C. botulinum will not grow in very acidic conditions. There is also less risk of the bacteria growing in foods stored at low temperatures or that have a high salt content. Which foods pose the most risk of botulism may differ from country to country, depending on food preparation and storage practices. /r/n/r/n In general, canned foods prepared at home without the use of safe processing methods are at the highest risk. There are also outbreaks of botulism related to professionally and industrially canned foods, though these outbreaks are much less common. /r/n/r/n According to the Centers for Disease Control and Prevention, canned foods that are at higher risk for botulism include /r/n/r/n if you think you may have consumed food contaminated with the bacterium that causes botulism, put the food in a container with a lid and bring it to your healthcare team for lab evaluation. /r/n/r/n Infant botulism occurs when the spores of the bacteria get into a baby's intestines, grow, and eventually produce the neurotoxin. Infant botulism is typically contracted from honey or corn syrup, which can be contaminated by botulism spores. It can also be contracted from contaminated soil. /r/n/r/n Wounds that become infected with Clostridium botulinum are generally associated with injection drug use, especially the injection of black tar heroin, a sticky, dark-colored type of heroin, into the skin or muscle. /r/n/r/n Surgical incisions, abrasions, lacerations, and open fractures can also increase the risk of this type of infection. /r/n/r/n Adult intestinal toxemia. Botulism is very rare and occurs when, as with infants, the spores of Clostridium botulinum get into a person's intestines and then grow and make the toxin. /r/n/r/n Sometimes botulinum toxin, Botox, is deliberately used for cosmetic injections to temporarily prevent the appearance of wrinkles, prevent migraine headaches, or relieve muscle stiffness. /r/n/r/n While it is not common, injections of botulinum toxin for medical or cosmetic reasons can cause unwanted paralysis of eye movement or facial muscles, which is usually temporary. /r/n/r/n Botulism is not a common medical condition, but if you experience face, eye, or mouth weakness, your medical team will do a thorough medical history and physical examination to determine the cause. /r/n/r/n Botulism may be considered alongside other, more likely diagnoses. /r/n/r/n During a person's evaluation for potential botulism, a healthcare provider will look for the presence of 3 criteria, based on data from the United States National Botulism Surveillance Database. /r/n/r/n In infants, a healthcare provider will look for a sudden onset of weak suck, drooping eyelid, lack of activity, and constipation. /r/n/r/n In order to assess for potential botulism exposures, various questions may be asked, such as, /r/n/r/n Because botulism symptoms can mimic several other neurological conditions, special tests may be required to make a diagnosis. Some of the conditions that can be mistaken for botulism include, /r/n/r/n Some of the tests that may be ordered include, /r/n/r/n Various laboratory tests are used to confirm a diagnosis of botulism. These tests evaluate blood, stool, wounds, or food sources to either look for the presence of the toxin or the bacteria. /r/n/r/n The results of botulism tests may take days to come back. This is why, if botulism is suspected, treatment is started before the diagnosis is confirmed. /r/n/r/n The treatment of botulism starts with immediate hospitalization and delivery of an antitoxin medication. /r/n/r/n With the discovery of a botulinum antitoxin and the advances in medical education and monitoring about this condition, less than 5 out of every 100 people with botulism died. /r/n/r/n The most significant complication of botulism is difficulty breathing. It is a common cause of death in people who have the illness. /r/n/r/n You may also experience complications such as, /r/n/r/n Botulism is a preventable disease. You can take steps to ensure the safety of your food and avoid contact with botulism toxin. /r/n/r/n Botulism does not have a taste or smell. You can't detect botulism toxin by sampling foods. /r/n/r/n Do not eat food that comes from dented, bulging, or leaking cans. If a can squirts liquid or foam when you open it, discard it and decontaminate surfaces touched by the liquid. /r/n/r/n If you practice home canning, Be sure to follow pressure cooker/canner instructions precisely to destroy spores produced by Clostridium botulinum. Boiling any home canned foods for at least 10 minutes is also important, considering the botulinum toxin is very heat labile. /r/n/r/n Low acid foods are at highest risk of contamination. If you can foods at home, avoiding low acid foods such as vegetables, figs, seafood, and meat can help prevent botulism. /r/n/r/n Refrigerate canned and pickled foods after you open them. Keep homemade oils that contain garlic or herbs in the refrigerator. /r/n/r/n Don't let potatoes baked in foil sit while they're cooling. They should be kept at temperatures of 140 degrees Fahrenheit or hotter until ready to serve. /r/n/r/n Refrigeration will prevent the growth of C. botulinum, and safe food storage is key to avoiding the bacteria in food. That said, strains of C. botulinum can grow at 37.4 degrees Fahrenheit or higher. If in doubt, boiling food at 185 degrees Fahrenheit for 5 minutes will kill the botulinum neurotoxins. /r/n/r/n Avoid giving honey and/or corn syrup to babies less than 1 year old. Their digestive systems are not developed enough to fight botulism bacteria before it can cause harmful effects. /r/n/r/n Be sure to obtain prompt treatment of all wounds. Likewise, avoid injection drug use to protect yourself from related skin damage. /r/n/r/n Botulism is a serious illness that requires immediate treatment. It is caused by botulinum toxin, typical Y produced by a bacterium called Clostridium botulinum. /r/n/r/n You can get botulism by eating improperly canned foods or commercially canned foods that have been contaminated with botulinum toxin. Infant botulism can occur when babies younger than the age of 1 consume contaminated honey or corn syrup. It is also possible to get botulism in a wound. /r/n/r/n If you have symptoms of botulism such as droopy eyelids, difficulty swallowing, or slurred speech, seek medical attention right away. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.